Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about back pain after knee replacement surgery. What are some of the reasons that you can have back pain and why is it so common after surgery? And what are the effective ways to manage and deal with it appropriately? Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our videos related to knee replacement surgery. So first, let's talk about what are some of the factors, some of the potential causes for low back pain after knee replacement surgery, and why is it relatively prevalent after surgery. And you want to think about the stresses that are going through the other parts of your body after surgery, your low back, your hips, your foot, your ankle. All these things are going to be experiencing different stresses throughout the body. And why is this? Well, you're going to be moving a little bit differently. Early on after surgery, you're going to have pain, stiffness, range of motion limitations. You're going to have weakness in your muscles. And when you're walking, when you're going up and down stairs, when you're sitting or relaxing, you're just going to be positioned a little differently. You're going to be moving differently. And that's going to put different stresses on different parts of your body that they might not be used to tolerating early on right after surgery. And then, of course, as you recover and as you get better, you're going to start moving more and more. You're going to be doing more intensive physical therapy. You're going to be getting back into more activities. And then your body's going to have to adapt again to that increase in activity level after you start to heal and recover and feel better. You also want to think about some things specific to the surgery itself. So you're probably most likely getting injections into your low back that can cause some discomfort. You're spending a prolonged time, even though you're under sedation in most instances, you're spending a prolonged time laying on a surgical table with your leg up in kind of an awkward position, and your back and the structures of your back are still experiencing those things, even though you might not be aware of them during the surgery itself. You also want to think about early on after surgery, you're probably not moving around as much. You're probably less mobile. You're probably spending a lot of time resting and icing and recovering. Hopefully you're doing some exercises, you're doing some walking, but early on you're probably not moving around as much, and that can cause a little bit of that stiffness, a little bit of that discomfort. And in the same breath as that, we want to talk about your sleeping is probably impacted. So you're probably having a relatively difficult time finding comfortable positions, sleeping for a prolonged time, and that's not uncommon that issues like that can contribute to low back pain and discomfort. So what we also want to think about besides the physical is also the psychological and the mental health aspect. There's a lot of different things going on after an intensive knee replacement surgery and the prolonged recovery and rehab afterwards. There can be depression, anxiety, fear of movement, hopelessness, isolation, depressed mood in general. And these things play a part, and it's going to contribute. Back pain, like any type of pain, is multifactorial. There's many different things that play a part and are pieces of the puzzle of what exactly is causing you to have low back pain symptoms. So keep those things in mind as well. So what can we do to manage and treat this effectively? Well, first of all, we want to keep working on what's going on with your knee and after knee replacement. And that means, working on your range of motion, working on strength, managing pain, managing swelling, managing the stiffness. And as those things start to improve, you're going to start to move better. You're going to start to tolerate activities more. And a lot of times just doing that by itself you're going to see over time improvements in what's going on in the rest of your body. If it's low back pain, if it's hip pain, whatever that may be, as you start to get moving, as you start to have better range of motion, strength in that knee, you're going to notice that the rest of your body starts to kind of settle in and tolerate things a little bit more. But, however, we want to make sure we're addressing the low back. So having that communication with your doctor, with your surgeon, with your physical therapist, and talking about what's going on with your low back or your hip pain or whatever it may be, and saying, I'm experiencing these symptoms, this pain, these things make it feel good, these things make it more painful, and they can work with you and give you a plan, give you things that are specific to the low back. We don't have to focus and get tunnel vision just on the knee. We can help you address the whole individual, the whole body, and give you exercises and give you activities and management strategies for the low back pain, as well as still managing and still working on what's going on with your knee. And just understand that there is still that psychological and that mental health aspect. Just like with the knee and the things that you are going to have to deal with and manage and be on top of with the knee, you can still have those impacts with low back pain. Any type of pain and discomfort can lead to some complications, some concerns about mental health, psychological health, and well-being. So making sure you're on top of those things, reaching out for support when you need it, finding ways to de-stress and to calm down and kind of have that recuperation and that recovery in different phases of your rehab. Having the social support and someone to talk to about what you're dealing with. That and many, many more beneficial ways to manage your mental health throughout this process. So again, low back pain is not uncommon after knee replacement surgery. The good thing is that just like how your knee can recover and heal and you can get back to tolerating things and the activities you enjoy, the same is very, very true for your low back. It takes a little bit of active management, being on top of things, being aware of it, having that communication with your health providers, but it's very manageable and can be addressed effectively through physical therapy and other relatively conservative treatment techniques. I hope you found this video helpful and insightful. Please be sure to hit that like button if you did to help spread this video to other viewers. Please be sure to leave your comments and your questions below, and I'll do my best to get back to you in a timely fashion. Thank you very much for watching.